Hello and welcome to the 2018 enrollment meeting for Thank You Nurses Employee Benefits. Today we're going to drive pretty quickly through the schedule of benefits for purposes of explanation and understanding. My name is Ben Hallback and I work for a company called Catto&Catto. We work with Thank You Nurses to make sure that everything that ends up in this guide is the least amount of cost that comes out of your paycheck for the maximum amount of benefit that you receive for the various lines of coverage. I'm going to scroll through this presentation. You'll also have access to it in print, but you'll see on this page that we have medical, supplementary benefit plans, dental, vision, basic life, accidental death and dismemberment, dependent life, and some COBRA options. The first thing to note is what you pick sticks for a year unless you have one of these qualifying life exemptions that the IRS allows us to change in the middle of the year. But in general, what you pick sticks for a year. We're going to go through the first two medical plans. They're being offered with Humana. The network is the National POS Open Access Network. So that's the question to ask any doctor or provider is, are you in my network? The plan year is January to December of 2018, and the first two plans are Plan A and Plan B. What you'll see on Plan A is that it has a high deductible of $4,500, a total out-of-pocket maximum of $6,350. After you hit this $4,500 deductible, all these 30% mean is that you are paying 30 cents on the dollar for any claim that comes in after you meet your deductible. So in the event of a big claim, you'll first fill up the deductible bucket, and then you'll pay 30 cents on the dollar as those bills come in. As those bills come in, you'll pay 30 cents on the dollar until you end up with an out-of-pocket maximum of $6,350. Also to note on this plan, is anything preventative related, annual physicals, mammograms, pap smears, childhood immunizations, flu shots, things like that are covered at 100%. So those are free to you on the cost of the plan. And we'll reference this a little later. You also have a telemedicine benefit through a vendor called Doctor on Demand. That's 24/7, 365 access to a doctor who can diagnose a condition and then send a prescription to the closest pharmacy should you need that. Again, that's 24/7, 365, and we'll talk a little bit more about that later. Plan B has copays throughout the year. A copay is just a discounted rate at the point of service. And so you'll see a little higher price tag for Plan B as compared to Plan A. And that's because you have copays throughout the year. Again, that's not the true cost of the visit to a primary care specialist. That's a discounted cost at point of service. You'll also see a lower deductible, which means you're responsible for less as compared to Plan A. But you'll also see approximately the same out-of-pocket max on both plans. And so in a catastrophic scenario, you would be out about the same amount of money either plan. Excuse me, it really just depends on utilization, meaning how often you go to the doctor or how often you fill a prescription. So that's why Plan B is a little higher in terms of cost. Plan C has copays also, has a $2,500 deductible, has copays on prescriptions, and has an out-of-pocket max of also $6,500. So we wanted to give you some flexibility in terms of options of different plans at different deductible amounts and copay amounts, and then see the resulting price tag of each plan. Plan D is the most expensive plan because it has the least expensive copays, the lowest deductible. Here are the 4-tier drug rates, and then the lowest out-of-pocket maximum. Here you'll see the costs that come out of your paycheck. Thank You Nurses also pays a pretty hefty price tag for the cost of the benefits on an annual basis. So part of these costs are shared with your employer. These are not the total rates. These are just the rates that come out of your paycheck. and it's broken up by employee only, employee plus spouse, employee plus children, and employee plus family for the various plans, depending on where you are in terms of your per hour rate. This indicates an option that is available only on Plan A. Plans B, C, and D are copay plans. So when you have a copay, you do not have an option to set up a separate bank account to put in tax-advantaged money into. Plan A is called a high deductible health plan. It does have a high deductible. And for that, you have the option of putting money out of your paycheck into a bank account that's in your name. If you spend that money on anything medical, dental, or vision, it gets loaded onto the debit card and you can pay a doctor, prescription. If you don't spend the money, then it rolls over and it's available to you even if you leave employment with thank you nurses. But again, that's only available on Plan A. I'm going to scroll back real quickly because some folks have been fairly active in the Go 365 Wellness program. Please remember that not only can you get gift cards at Amazon, iTunes, Under Armour, various places like that, Macy's, Target, but you can also find ways to decrease the cost that you saw earlier, depending on hitting silver, gold, or platinum levels in Go 365. We're pretty involved with Thank You Nurses in terms of our education around the Go 365 Wellness program, and there will be more information coming down the pike on that later throughout the year. This slide that you see here is at points of care access, and as the bars scroll up, they get more expensive. The point I want to make is that in any major market in Texas, you'll see freestanding emergency rooms. That is an emergency room that is not in the hospital. It's not an urgent care provider. It is a freestanding emergency room. So if you go into a freestanding emergency room when it is not a true emergency, meaning not life or limb threatening, there will likely be a very, very, very high cost for that visit, to the tune of several $1,000s. And so I want us all to be very, very aware that going into any type of an emergency room when it is not life or limb threatening is extremely expensive. These following pages list off what's covered at 100%, meaning free to you. It's covered by the cost of the plan. So you'll see some adult preventative services, see some immunizations, a couple different kinds of counseling, screenings, some kiddo preventative services. So we wanted to have that there for you for future reference. This is the Doctor on Demand app. This is available on every single plan. It's $49. This slide will indicate $40. The Doctor on Demand company has not had a chance to update their marketing materials yet, but it is $49. And so this is a very user-friendly way, 24/7, 365. I did one of these in the middle of a coffee shop. It took me 17 minutes. I had seasonal allergies and a sinus infection. And then I got a prescription sent to the closest Walgreens to my location. It took me less than 20 minutes. This is more information on the Go 365 app. Please call our office if you need help signing up or understanding what you are entitled to as a part of this program. But we wanted to give you some information so that you could begin to log in and track your steps and start accruing points. So I'll speed over this because you can review it later and you can call our office if there are any other questions. What this slide shows is voluntary supplemental benefit plan. So Colonial Life Insurance Company is a company like an Aflac company. It's a different company, but it is like Aflac. So when an event happens like an accident, then depending on the severity of the accident, the check comes to your mailbox and you can use that money to pay doctors, groceries, bills, whatever you would like. If you have more questions, then please call our office and we can route you to Colonial so that you can make the best and most informed buying decision. Dental coverage is with Humana. We made a change to a different carrier. The network is the traditional preferred dental PPO. And here you see the benefits. An example would be if you go in for a preventative service, it's free to you, covered by the cost of the plan. But let's say that they find a cavity, and let's say the bill is $200 for a cavity. The cavity would fall in basic service. So if the cavity is $200, you're first going to meet your deductible of $50. At that point, you'll have a $150 bill. You'll be paying 20% of 150, which is $30. Insurance will be paying 80% or $130 of that $150 bill, and that $130 that they just paid post towards the claims that are registered against the plan. Orthodontia has a max of $1,000. Anybody who's got kiddos that needs braces knows that braces cost more than that. And so you'll get $1,000 per kid who needs braces. I've got 3 kids in my family, and 2 of them need braces right now. And so my dental benefit plan actually looks a lot like this. So I'll get something for participating in dental, but I won't get the full cost of braces covered. The rates are here. And now we'll talk about vision. Vision is pretty inexpensive. The thing that confuses most people is this area that says benefit frequency. This means you can't get glasses and contacts in the same year. It's either or. So you either get a frames allowance and lenses for those glasses or contacts, not both paid at the same time. The other thing to note is you may not get out of the eye doctor for a $10 copay depending on what you do to your lenses. So I have pretty bad eyesight. I've got to shrink my lenses down just so they fit on my face. And so I'm not getting out for a $10 copay because I've got to have progressives and UV protection, and I've got to get a lot thinner, lighter lenses. Basic life, accidental death and dismemberment, and dependent life, all of that means a life insurance amount of $15,000. Here's the cost per paycheck. You can also get some for spouse or kiddos. Just make sure that when you fill out the forms that your beneficiary information is accurate. The beneficiary is who the money goes to if you're no longer living. It can be anybody you want it to be. An employee assistance program is free to you, covered by the cost of the plan. It's for confidential counseling services. So think will prep, or think a couple of different over-the-phone counseling services. There's more information listed on the following pages for what is included in the EAP on pages 19 and 20, along with the number. Most of it, honestly, is you just have to remember that it's there. I'm going to scroll back up, and one of the last comments that I'll make is a premium-only plan just means that your benefits come out not taxed. So that's the way that we want it. We don't want you to have to pay tax on these benefits, and so we've got to indicate that to you here. The rest of the information in this packet are required notices that we won't cover in the webinar today, but they're there for your reading enjoyment at any point during the year. And the page that I'll end on is coming up right here. Jenny Jinks is the Thank You Nurses dedicated account manager in our San Antonio office. She's available for any claims questions, any access to care, any prescription questions, questions about what is covered under the plan and what is not. We're available all throughout the year. We work all over the state of Texas. We welcome phone calls to come to us directly when there's a question, but we also want to list out all the different numbers of the vendors that you have in your lineup. So that'll conclude our meeting today. Thank you for all you do for Thank You Nurses, and have a great day.